Hey family, can we talk? So the COVID-19 coronavirus has literally changed life as we know it. If you live in New York State or Illinois or California, you're likely under a stay-at-home order mandated by your governor in order to flatten the curve. Now this phrase, flatten the curve, has been thrown around a lot these last couple of weeks as it relates to social distancing around the corona apocalypse. But flattening the curve, what does that actually mean? Many believe that social distancing has been implemented to keep us from getting sick. And that's half true. The full truth is that we're social distancing to flatten the curve of illness so that we don't all get sick at the same time. COVID-19 is a novel virus to humans, meaning we have no natural immunity or defense to it. Therefore, until a viable vaccine or cure is introduced, experts expect that 40 to 70% of the U.S. population will be exposed to COVID-19 over the next 12 to 18 months and maybe even longer. That's an average of 160 million people, or half of the U.S. population. See, we're beyond containment at this point, and we have been for quite some time. The understanding is that most of us will become carriers eventually. That's just how science works. No immunity, no protection. So flattening the curve is about care, not containment. Our healthcare system would literally collapse under the pressure of 160 million symptomatic patients at the same time. So while this coronavirus is dominating the news cycle, people are still involved in car accidents, shootings, and other forms of trauma. Babies are still being born, and people still need care for heart disease and cancer and kidney and lung disease and other poverty-related illnesses. That hasn't changed. COVID-19 has only added to that burden. Social distancing is to ensure that we don't all get sick at the same time so that those who are more likely to get sick, mainly seniors and immunocompromised folks, can be prioritized for care while not displacing people who still require health care apart from this corona apocalypse. So, while you're at home complaining about being quarantined, remember that you are a part of a larger system that is relying on you to make some sacrifices so that that system might survive. This isn't about who has COVID-19 and who doesn't, because many of us will be exposed in due time. This is about when. So folks, help us to flatten the curve. Stay at home. Stay at home now so that our healthcare infrastructure can survive this wave of infections and sustain us through the next. Remember, we all used to be somebody else. What's most important is that we're always working to be better today than we were yesterday. You be the cure you wish to see in the world. Peace and blessings.